Hello, everyone. Let me ask you something. Have you ever been sick while traveling abroad? Maybe you had a high fever. Maybe you couldn't stop coughing. Or maybe you had a terrible stomachache. You know you needed to see a doctor, but you had no idea what to say. That can be scary. Many English learners know lots of vocabulary, but when they sit in front of a doctor, they suddenly forget everything. The doctor asks, "What seems to be the problem? What seems to be the problem?" And all they can say is, "I'm sick." Today, we are going to change that. By the end of this lesson, you'll know exactly how to describe your symptoms, answer the doctor's questions, understand simple medical advice, and leave the doctor's office feeling confident. Everything you'll learn today is practical, natural, and used by native speakers every day. So, let's imagine you're visiting a doctor's office. You walk into the room. The doctor smiles and says, "Good morning. Please have a seat." You sit down. The doctor asks, "What brings you in today?" What brings you in today? This is one of the most common questions doctors ask. It simply means, why are you here today? Why are you here today? A natural answer could be, "I've had a fever since yesterday." I've had a fever since yesterday. Or I've been coughing for 3 days. I've been coughing coughing for 3 days. Or I've been feeling tired lately. I've been feeling tired lately. I've been feeling tired lately. Or I have a terrible headache. I have a terrible headache. Notice something important. Instead of saying, "I'm sick," native speakers usually explain their symptoms. That's much more helpful. Let's practice a few examples. I have a sore throat. I have a sore throat. My stomach hurts. My stomach hurts. My back hurts. My back hurts. I've been feeling dizzy. I've been feeling dizzy. I have a runny nose. I have a runny nose. I'm having trouble sleeping. I'm having trouble sleeping. I've been feeling weak. I've been feeling weak. These are all very common expressions. Now imagine the doctor asks another question. When did it start? You could answer, "It started yesterday, last night, this morning, about a week ago, about a week ago." Then the doctor asks, "How severe is the pain?" If it's very bad, you can say, "It's really painful. It's very severe." Or simply, "It hurts a lot." It hurts a lot. If it's not too bad, you can say, "It's mild." It's mild. It's not too bad. It's not too bad. Or it's uncomfortable, but manageable. It's uncomfortable, but manageable, but manageable. It's uncomfortable, but manageable. Now, let's have our first real conversation. Doctor, good morning. What brings you in today? You. Hi, doctor. I have had a sore throat and a fever since yesterday. Doctor, I'm sorry to hear that. Have you been coughing? Have you been coughing? Have you been coughing? You. Yes, quite a lot. Quite a lot. Doctor, do you have any allergies? Do you have any allergies? Do you have any allergies? You. No, I don't. No, I don't. Doctor. All right. Let's take a closer look. Let's take a closer look. Let's take a closer look. Perfect. That conversation sounds completely natural. And the best part, there isn't a single difficult sentence. It's all simple English. The kind of English that anyone can learn and use. In the next part of this lesson, we'll learn how to answer the doctor's questions, talk about your medical history, understand the doctor's advice, and ask the right questions before you leave the clinic. Now, let's continue our visit to the doctor's office. You've already explained why you're here. Now, the doctor wants to learn more about your condition. Don't worry. The questions are usually simple, and once you know them, you'll hear them everywhere. The doctor might ask, "Can you describe the pain?" Can you describe the pain? Can you describe the pain? This means the doctor wants to know exactly how you feel. You could answer, "It's a sharp pain." It's a sharp pain. Or it's a dull pain. It's a dull pain. Or simply, it hurts a lot. It hurts a lot. It hurts a lot. If the pain isn't very serious, you can say, "It's not too bad." Or, "It's uncomfortable." It's uncomfortable. Uncomfortable. Another common question is, does it hurt all the time? Does it hurt all the time? You can answer, "Yes, it does." Or, "No, it comes and goes." It comes and goes. That means the pain isn't constant. It disappears for a while and then comes back. It disappears for a while and then comes back. Now, the doctor might ask, "Have you had this problem before?" Have you had this problem before? Have you had this problem before? You can answer, "No. This is the first time." This is the first time. Or, "Yes, I've had it before." I've had it before. I've had it before. Maybe the doctor asks, are you taking any medication? Are you taking any medication? This is a question you'll hear very often. If you're taking medicine, you can say, yes, I'm taking medicine for my blood pressure. Or, I'm taking vitamins. I'm taking vitamins. Or, I'm taking antibiotics. Antibiotics. I'm taking antibiotics. If you're not taking anything, just say, no, I'm not taking any medication. I'm not taking any medication. I'm not taking any medication. Now, here's another important question. Do you have any allergies? Do you have any allergies? Allergies? If the answer is no, say no. I don't have any allergies. No, I don't have any allergies. I don't have any allergies. I don't have any allergies. If the answer is yes, say yes. I'm allergic to penicillin. I'm allergic to. I'm allergic to penicillin. Or I'm allergic to peanuts. I'm allergic to peanuts. The doctor may also ask about your lifestyle. For example, do you smoke? Do you smoke? You can answer, no, I don't. Or, yes, occasionally. Occasionally. Yes, occasionally. Another question could be, do you drink alcohol? Do you drink alcohol? Again, answer honestly and simply. Now, let's learn a few useful expressions that many English learners forget. Suppose you're feeling tired all the time. Instead of saying, I'm very tired, I'm very tired, you can say, I've been feeling exhausted lately. I've been feeling exhausted lately. I've been feeling exhausted lately. Or I've been feeling weak. I've been feeling weak. These expressions sound much more natural. Now, let's practice another conversation. I'll be the doctor, you be the patient. Ready? Good morning. What brings you in today? Have you had a fever? Are you taking any medication? Do you have any allergies? All right, I'd like to examine your throat and listen to your lungs. Excellent. Notice how simple that conversation was. No difficult vocabulary, no complicated grammar, just clear communication. And that's exactly what matters when you're talking to a doctor. You don't need to sound like a medical expert. You just need to explain how you feel. In the next part of this lesson, you'll learn how to understand the doctor's advice, how to ask important questions before you leave, and how to talk about prescriptions. Prescriptions. Medical tests and follow-up appointments. Appointments. Let's keep going. Now that you've answered the doctor's questions, it's time to hear the diagnosis, and understand what the doctor wants you to do. This is one of the most important parts of the conversation. Let's imagine the doctor has finished examining you. The doctor smiles, and says, "The good news is it's nothing serious. The good news is it's nothing serious." That's something everyone likes to hear. It means your condition isn't dangerous. The doctor continues, "It looks like you have a viral infection." A viral infection. Or maybe, "I think you have the flu." I think you have the flu. Or, "You have a common cold." You have a common cold. Don't worry if you don't understand every medical term. The doctor will usually explain everything in simple language. Now, let's talk about advice. One of the most common things a doctor says is, "You need to get plenty of rest." You need to get plenty of rest. That simply means sleep well and give your body time to recover. Another common sentence is, "Drink plenty of fluids." In other words, drink lots of water. You may also hear, "Stay hydrated." Stay hydrated. Stay hydrated. That's another way of saying, drink enough water throughout the day. The doctor might also say, "Avoid cold drinks." Avoid cold drinks. Or try to eat light meals. Try to eat light meals. Or stay home for a few days. Stay home for a few days. These are all very common pieces of medical advice. Now, let's talk about prescriptions. Prescriptions. The doctor may say, "I'm going to prescribe you some medication." I'm gonna prescribe you some medication. That means the doctor will write a prescription for medicine. You can respond by saying, "Okay," or "Thank you." Okay? Thank you. If you have questions, don't leave without asking them. For example, "How long should I take this medicine?" How long should I take this medicine? How long should I take this medicine? Or, should I take it before or after meals? Should I take it before or after meals? Or, can I continue working? Can I continue working? Or, when should I start feeling better? When should I start feeling better? When should I start feeling better? These questions are completely normal. Doctors hear them every day. Now, imagine the doctor wants you to have a medical test. The doctor might say, "I'd like you to have a blood test." I'd like you to have a blood test. Or, "I'd like to take an x-ray." I'd like to take an x-ray. Or, "We need to do some additional tests." We need to do some additional tests. We need to do some additional tests. If you don't understand why, simply ask, "Could you explain why I need this test?" Could you explain why I need this test? That's a polite and natural question. Sometimes the doctor may ask you to come back. You might hear, "I'd like to see you again next week." I'd like to see you again next week. Or please schedule a follow-up appointment. Please schedule a follow-up appointment. A follow-up appointment means another visit to check if you are getting better. Now, let's practice another conversation. Doctor, after examining you, I think you have a mild throat infection. After examining you, I think you have a mild throat infection. I'd like to prescribe some medication. Patient, okay, how long should I take it? Doctor, take 1 tablet twice a day for 7 days. Take 1 tablet twice a day for 7 days. Patient, should I take it with food? Doctor, yes. And make sure you drink plenty of water. Make sure you drink plenty of water. Patient, can I go to work tomorrow? Can I go to work tomorrow? Doctor, I'd recommend staying home for at least 2 days. Your body needs some rest. I'd recommend staying home for at least 2 days. Your body needs some test. Patient, all right. Thank you for your advice. Thank you for your advice. You're welcome. I hope you feel better soon. I hope you feel better soon. Notice something important. The patient didn't try to use complicated English. The patient asked short, clear, and polite questions. That's exactly how real conversations happen. Remember this. Communication is more important than perfection. Communication is more important than perfection. If people understand you, you're already speaking successful English. In the final part of this lesson, we'll review everything you've learned with one complete conversation from beginning to end. Then I'll give you a speaking challenge to help you practice these expressions in real life. Let's finish today's lesson together. Now it's time to put everything you've learned into one complete conversation. Imagine you've been feeling sick for several days. You decide it's finally time to visit a doctor. Let's begin. Doctor, good morning. Please come in and have a seat. What brings you in today? Please come in and have a seat. What brings you in today? Patient, good morning, doctor. I've been feeling sick for the past 3 days. I have a sore throat, a bad cough, and a slight fever. I have a sore throat, a bad cough, and a slight fever. Doctor, I'm sorry to hear that. I'm sorry to hear that. When did your symptoms start? Patient, they started 3 days ago. At first, it was just a sore throat, but yesterday I started coughing. Doctor, I see. Have you taken any medication? Have you taken any medication? Patient, no, I haven't taken anything yet. I haven't taken anything yet. I wanted to see a doctor first. I wanted to see a doctor first. Doctor, that's understandable. That's understandable. Understandable. Do you have any allergies? Patient, No, I don't have any allergies that I know of. I don't have any allergies that I know of. Doctors. All right. I'd like to check your temperature. Check your temperature and listen to your breathing. I'd like to check your temperature and listen to your breathing. Please take a deep breath. And again. Good. Now, let me take a look at your throat. Open your mouth and say, Open your mouth and say, Excellent. From what I can see, it looks like you have a mild throat infection. From what I can see, it looks like you have a mild throat infection. The good news is that it's nothing serious. You should recover within a few days. You should recover within a few days. Patient. That's a relief. That's a relief. What should I do? Doctor, I'm going to prescribe you some medication. I'm going to prescribe you some medication. Take 1 tablet twice a day after meals. Drink plenty of water. Get lots of rest. And avoid cold drinks for a few days. Patient. Should I stay home from work? Doctor? Yes. I recommend staying home for at least 2 days. Your body needs time to recover. Patient. Are there any side effects? Doctor. You might feel a little sleepy after taking the medicine. If that happens, avoid driving or operating heavy machinery. Patient. Okay. How long should I take the medication? How long should I take the medication? How long should I take the medication? Doctor. For 7 days. Even if you start feeling better, finish the entire course. Even if you start feeling better, finish the entire course. Patient. Thank you very much, doctor. I really appreciate your help. I really appreciate your help. I really appreciate your help. Doctor, you're very welcome. I hope you feel better soon. Take care. Great job. Now let's review some of the most useful phrases from today's lesson. Instead of saying, I'm sick, try saying, I've had a sore throat since yesterday. I've had a sore throat since yesterday. Instead of saying, it hurts, be more specific. Say, I have a sharp pain. I have a sharp pain. I have a sharp pain. Or my stomach hurts. My stomach hurts. Or I've been feeling dizzy. I've been feeling dizzy. When the doctor asks, what brings you in today? Don't panic. What brings you in today? Simply explain your symptoms. When the doctor gives you medicine, don't forget to ask, how often should I take it? How often should I take it? Should I take it with food? Are there any side effects? How often should I take it? Should I take it with food? Are there any side effects? And when should I start feeling better? When should I start feeling better? These questions will help you understand your treatment and communicate with confidence. Now, I'd like to give you a speaking challenge. Imagine you're sitting in a doctor's office right now. The doctor looks at you and asks, "What brings you in today?" Pause the video. Answer the question out loud. Answer the question out loud. Describe your symptoms using complete sentences. Then continue watching. Remember, speaking is a skill. The more you practice, the more confident you become. Don't be afraid of making mistakes. Every mistake is a step toward fluency. If today's lesson helped you, make sure to subscribe to the channel. Every week, you'll learn practical English that you can actually use in real life. No complicated grammar, no boring vocabulary lists, just real English for real conversations. In our next lesson, we'll learn how to speak English at the airport. You'll learn how to check in, drop off your luggage, go through security, find your gate, and communicate confidently with airport staff. Until then, keep practicing, keep speaking, and remember, the best way to learn English is to use it in real life. Thank you so much for watching. I'll see you in the next lesson.